This segment of Delmarva Life is brought to you by Peninsula Regional Medical Center.
A soldier in Afghanistan is making a special trip home to try to save his grandfather's life.
The 21-year-old is returning to be tested as a possible match for his dying grandfather in need of a liver. He spent 4 years in the Marines, 16 in the Army. He survived the savage fighting in Vietnam. But now 62-year-old Rick Homer is dying.
I found out about it a little over 3 years ago, what they call hemochromatosis. Doesn't purify the blood like it's supposed to.
He could have been on a donor list for years, but his grandson, 21-year-old Army Specialist Ricky Glenn, came to his rescue.
I'm the firstborn grandson, and I carry my grandfather's name. So, and the loss and the regret of me knowing that I could have done something and didn't do it would have outweighed more than doing it now.
Glenn arranged with his commanding officer to be flown back from Afghanistan to be tested as a match. He'll donate 60% of his liver.
Proud, a feeling of, that my husband and I raised him right. He called me after he had spoken to his commanding officers and told me.
His family says Glenn's act personifies honor, courage, and love.
And one of the doctors said, tried to talk him out of it, and he said no.
But Homer knows only one way to describe it.
He's my hero. People don't understand what hero is until something like this happens.
For Glenn, it's all about family.
I don't really see myself as a hero. You do what you do for the ones that you love.
Now, if found to be a match, it'll be a few weeks before that donation's made.
Well, Rick is certainly a lucky man. Doctors got in there, found out what was wrong, and put a plan of action into place. But what if the diagnosis isn't always that easy? Well, there's another serious liver disease that's actually on the rise. The thing is, it's usually only found by accident.
Carla Carter is a model patient. As a diabetic, she has apps for food, exercise, printouts of charts, graphs of her sugar levels, and insulin for her doctor. Her lifestyle is clean.
I lost 10 pounds. I go to the gym 5 days a week. I've changed my diet. My good carbs is all my vegetables.
It started with a scare, a big one 5 years ago when this mother of four was only 30.
Oh my God, I'm gonna need a transplant. What am I gonna do?
Carla was diagnosed with a dangerous case of fatty liver disease, something usually found by accident. She was on her way to cirrhosis.
That's one of the unfortunate things about liver disease. Until it's very, very advanced, there's simply no symptoms often.
It's not from alcohol. People at risk have diabetes or pre-diabetes and carry fat around the belly rather than hips and thighs. Diets high in refined sugar and fructose are thought to contribute. Some people progress to cirrhosis, liver failure, and cancer.
Even people who never get liver failure from fatty liver, we believe are at increased risk for heart disease and stroke down the road.
But now Carla has new hope. She is in one of 3 worldwide or nationally fatty liver studies, testing medications that could help.
This was a very minor issue decades ago, and once hepatitis C is brought under control, this will become the dominant liver disease in the United States, maybe the world.
And right now it's believed 30 million people have fatty liver disease, and as we just heard, that number may skyrocket.
Yeah, so what can you do to make sure you don't become a statistic? Well, joining us today to tell us a little bit more about fatty liver disease is Dr. Halim Charbel, who is a gastroenterologist with Peninsula Regional Medical Center. Thank you so much for coming in today.
Thank you.
So we're talking fatty liver. I'm seeing this picture in my mind. Is it a fat liver? Is that what it is?
Pretty much. It's basically deposition of fatty acids and fat within the liver cells.
So it's like in the cells. It's not like a marbling that we would actually see.
No, it's deposition within the liver cells, and the liver swells and becomes, there's a lot of fat in it and becomes disease, can be inflamed and cause problems.
So what does it do to the body?
So fat in the liver can cause inflammation in the liver cells, and that can cause scarring and lead to cirrhosis. And that can cause all the complications of the cirrhosis, particularly needing a liver transplant or causing an increased risk of liver cancer. but also people who develop fatty liver disease can have diabetes or high cholesterol, high triglyceride, and central obesity, and what we call the metabolic syndrome. And these patients are at increased risk of developing heart disease or strokes or other complications.
Now, with all the things that you just listed that are increasing the risk of this, you say that you're seeing more of a trend that's really starting to bother you.
Absolutely. We are seeing more and more of patients diagnosed with this disease, but mostly we are seeing more young patients diagnosed with this disease. So in practice, we see adolescents who are suffering from obesity, and we're diagnosing them with fatty liver disease. And compared to older people who are diagnosed with this, these patients have a much higher risk of developing complications because they are starting with this disease at such an early age.
And as we just heard, fatty liver disease will likely become the dominant liver disease. Why is that?
Absolutely, it will be, because now we are seeing a major obesity epidemic in the United States and in the world in general, and that is the major cause leading to an increase in fatty liver disease. At the same time, currently the #1 cause leading to liver transplant in the US is hepatitis C, but with newer medications that we are using to treat hepatitis C, we think that in the next few years we will be able to control hepatitis C. While fatty liver disease is on the rise, it will become the #1 cause of liver disease, eventually leading to liver transplant.
So is there anything we can look for, any symptoms that we know, uh-oh, there's a problem?
Most of the patients who have this do not have any symptoms. So in most cases, we find out about it by a blood test or by accident. As we said, we're checking for something else and we notice a fatty liver, either an enlarged liver on exam or on an ultrasound. But some patients can develop non-specific symptoms such as mild abdominal pain or fatigue.
Oh, okay. So what can we do to prevent it in the first place?
There are a lot of things that we can do, mostly lifestyle modifications that can affect this, mostly fighting obesity, so diet, weight loss is a big one, and exercise. So it's well proven that weight loss, significant weight loss, but slow, steady weight loss can improve the histology of the liver, decrease the fat deposition in the liver. And it is well proven that exercise, even if it does not lead to weight loss, will also improve the disease and halt or decrease its progression.
So we can't get rid of it yet, but we can stop it from getting worse?
We can absolutely either slow it down or stop it from getting worse by the lifestyle modifications we talked about. So exercise, diet, and weight loss. There are medications that we can try to use. Many medications were already tried. Most of them did not give us significant effects. There are some of them that can help in specific situations, but there are also a lot of medications that are currently being tested for this. One important thing is that if the person has diabetes or they have high cholesterol, they definitely need to be checked by their doctors and control these situations really well, because that would also decrease the deposition of fat in the liver.
Can we reverse the condition any?
To some degree we can, with as we said, diet and weight loss and exercise. We do see some decrease in the deposition of fat in the liver. So it is reversible to some degree, but it is usually a metabolic environment in the body that is causing this and affecting all the liver cells. So we don't think we can reverse it completely, but at least slow it down or reverse some of it.
All right, the younger we start, the better. Thank you so much
Thank
for
you.
the information. And to read more about PRMC or for more information on fatty liver disease, go to delmarvalife.com and click on the Show tab. Well, still ahead on Delmarva Life, how do you spell victory? Well, this young lady can tell you. After winning the UMES Regional Spelling Bee, now she has her sights set on the Scripps National Spelling Bee. She puts our spelling skills to the test next.
Uh-oh. And these students are doing big things too. We're going to learn about the program that's sharpening their skills and empowering them to succeed. But first, we just learned about liver disease. Dr. Oz says another vital organ you want to stay healthy is your gallbladder.
Hi, I'm Dr. Oz. Your gallbladder stores and releases bile, which helps your body process fat. Common symptoms of gallbladder problems are indigestion, infection, nausea, and vomiting. If your gallbladder isn't working properly, your doctor may suggest removing it. Afterwards, consider a probiotic supplement and reducing dietary fat.